We're getting closer to learning the treatment plan that can bring you closer to that soft, smooth, creamy baby skin. But first, let's learn about skin texture and how Dr. Yovino treats facial scars. It's amazing. I have just large pores on my hands. They don't really bother me. However, if they were on my face, I'd be looking for a way to make them smaller. 1 to 10, how possible is it for aesthetic treatments to reduce pore size on the face?
I'd say probably like an 8 to 9. It's
Really?
easy to reduce pore size, depends on how stretched out the pores are. But microneedling is a very, very good procedure. Microneedling or even CO2 laser or radio frequency, if it's done like the CO2, if it's like a Venus Viva, let's say, those are very easy to, over multiple treatments, shrink pore size.
Fantastic. Like how much can you shrink them?
Well, you can blend them very well. I mean, there's somebody that I'm thinking of in particular. He had very large pores on his nose. I think he just has a very oily T-zone. And so in that area, his pores are very stretched out. And we've done probably, maybe over the years, 5 microneedling procedures on him, a series of 3, and then a year later, another one, a year later, another one. And I've successfully smoothed out his nose. So, I know that there were pores there that were large and stretched out. So to me, I can still see a little bit of a little bit of, but it's nothing like it was. Because every time I would look at him, I'm like, I got to microneedle that nose of yours. And so now it's nice and smooth.
That is fascinating. What is it? Is it kind of burning in the pores or what is the technology?
No, microneedling is it's like a pen. Oftentimes the pen is hooked up to directly into the electricity, like has a thing, or it's battery operated, and it has different heads. And at the head typically will have anywhere from 12 or more 32 gauge needles, and they very quickly come in and out of the tip of the pen. And so you glide it across the skin and it basically stamps the skin like a lawn aerator. If you ever lived on the East Coast or Midwest, that we've always had lawn aerators where they would stamp, with these like needle type of things to allow more oxygen and stuff into the grass. But it's sort of the same philosophy with the skin, and anything can be used as a glide. Most people will use like a hyaluronic acid or people's platelet-rich plasma or exosomes or other things like that to glide across the skin, so it doesn't like scratch the skin. And depending on what you're treating, you're going to set the depth of the needle penetration anywhere from 0.5 millimeters to 2 millimeters typically. There are some pens that go deeper than that. But that isn't really necessary for the face.
Okay. I don't know why I thought RF had some heat to it as well.
Well, that's radio frequency, but you asked microneedling. So
I did. Okay. I'm getting
yeah. There is RF microneedling, and that is something like a Morpheus 8 or Profound or those kinds of machines. Those are a combination of microneedling with radio frequency. So when the needles go into the deeper layers, then the radio frequency current gets emitted, and that is supposed to help tighten the skin from inside out.
Oh my gosh, the technology is amazing. I just can't believe that you can make a pore smaller. I thought you'd give me a 1. We are so happy to welcome Dr. Sarah Yovino, who leads the entire non-surgical side of Ideal Face and Body in Beverly Hills. Dr. Yovino, welcome back to Beauty Seek.
Thank you.
I have fine lines that I feel like they appeared overnight, right around the eyes. 1 to 10, how possible is it really to treat fine lines non-surgically?
Well, it's a 10 out of 10 if you catch them early. So there's, the prejuvenation before they actually occur. And then there is, the rejuvenation if they're there and you can make them disappear 100%, then you've still caught it early. But if you let I call it the crack, get deeper and deeper and deeper, then it becomes much more difficult to get rid of. But if you catch it early, you can get rid of it 10 out of 10. That's, a neurotoxin, Botox, Dysport, Jeuveau, Ledibo, anything like that is botulinum toxin, different brands. But the main thing with that is that you just prevent movement. And if you prevent movement and keep everything still, then you won't form the crack.
Okay, gotcha. Prejuvenation. Is this a whole movement?
It is a movement. It is the young TikTokers who get on and learn and say, oh my God, I got to do this before I get it. And so they spend a lot of time researching skincare, researching procedures, doing all this kinds of stuff. And they come in and they want everything starting at a younger age. Yeah.
Wow. Oh my gosh. They're all going to look like babies forever. I have, I'm sad to say, a bit of maybe crepiness on my forehead. My friend kindly pointed it out to me once back in the day, and now I'm hyper aware. I've tried peels, but I don't really feel like they have any effect. 1 to 10. If you have the crepes, crepiness, how likely is it that you can ever get rid of it?
Well, it depends, okay. So everything depends. Everyone's different. So it's very difficult to answer that question because everyone is different. But it's like typically when you're feeling the crepiness or seeing the crepiness, it's from multiple different things. It's number one, you've lost a lot of like hydration to your skin. So I don't know if you're using retinols and other serums, especially with hyaluronic acid to help pull hydration back into your skin. Are you doing that?
I've done the retinols and tretinoin. I feel like it dries my skin out more. Is that a thing or is that not
Well,
common?
it is if you're overusing it, you're going to feel dry. So retinol is intended to slough off your dead layer of skin. And it's intended to increase cell turnover, to make your skin overall thicker as time goes on and make it more youthful. It's amazing at clearing up fine lines and wrinkles if used appropriately. But you have to understand your skin and see what your skin can tolerate. So a lot of people go gangbusters and they get tretinoin or they get all this other stuff. They start trying to use it every single day and their skin gets red, chappy, like irritated. And then they're like, oh, this doesn't work for me. It's making me worse. I'm not going to use it ever again. And
Yeah.
I see that and hear that a lot from patients that come in. And so the key for anything, it's like, I always say retinol is like the tortoise that won the race, with the tortoise and the hare.
Mhm.
It's slow and methodical and consistent. And over time, over months, you are going to start to reap the benefits. I remember when I was in Miami, I had a patient that she was like 85. Her name was Esther. And I remember her skin was so smooth. And I was like, Esther, wow, your skin is so nice. Like, what have you been doing? And she goes, well, I just use retinol. I did notice that her skin was great, like here, but all the way to the edge, I could see the crepiness. And so she must just be doing it in the central and wasn't going all the way to the hairline. So I make sure I tell every patient, whatever you do, make sure you go all the way to your hairline when you use it. But retinol, you want to start out with the lowest dose, 0.025%. You're going to put it on your skin and you're not going to use it for the next 2 nights. You're going to wait 2, not 3 nights, a week, whatever it's going to take to get your skin feeling like it's did before you started. And that's what your window period is to use it again. And then you use it again. And then slowly you're going to maybe do it at the 6-day mark and repeat it. And then eventually 5 days, 4 days, 3 days, like that kind of a thing. The rule of thumb is whatever decade you're in of life, you use it that many nights to help your skin.
Really?
So if you're in your 30s, you want to work your way up to being able to use it 3 nights a week. If you're in your 40s, 4 nights a week. If you're in your 50s, 5 nights a week. That's kind of the rule of thumb with that. And, listen to your skin. If 5 nights a week is too much for you because your skin is so irritated and chapped, then don't do it. Back off. Let your skin recover. See what your skin can tolerate. But the more you use it, the better your skin's going to look in the long run. It's going to slough off your dead skin, take away some of your sunspots. Depends on what it's mixed with. Like we have it in the office with Yovino MD Beauty. It's mixed with vitamin C and E. So as it's sloughing off the dead skin, it's also treating your sunspots with the vitamin C and E. So it is a combination. We have a combination one, but depending on what it is, you can always layer it with other things. But just know if it is retinol, you use it at night only because it deactivates in the sun. When they say, oh, you can burn more on it, what that means is you're sloughing off all your dead layer and you have fresh, nice, beautiful skin underneath. And so you are more prone to the sun rays. So just make sure you wear sunblock, make sure you reapply the sunblock and protect yourself.
Okay. I've never heard it described that way. Thank you very much. Because I'm sure I was just creaming it on and like I'm irritated. I'm like, oh, I'm sensitive to this, but I have a drawer with a few of those in. I'm going to go back to it.
Yeah.
I'm going to have to do the
Start
5
at the
nights
lowest dose. Yeah. Start at the lowest dose. Use it once and wait. And when you feel like, okay, my skin feels like it did before, then you can use it again. And then when you are using it consistently and you don't feel like you see any of that sloughing off or the peeling or anything like that anymore because you've been on that dose for so long, that's the time to upgrade to the next level dose.
Is it?
Yeah.
Oh my gosh. Okay. So, and you can do it all the way down your neck and your décolleté.
Yeah. The neck
okay.
is a little bit more sensitive than the face. But I do it on my neck and pull it down into my chest. Just make sure that you might want to dilute it a little bit in the neck area. And another thing is that you can always couple it with a growth. Say you are very sensitive. You can always couple it with a growth factor cream. So you put the retinol on first and then you put the growth factor on over it to help soothe the skin. So it's not all red and chappy.
Okay. Oh my gosh, this is fantastic. I'm going back to it because it's just kind of like when I catch it in the light, it's like, oh, there's that little pattern. I don't like that.
And do you have do Botox or Dysport in your forehead?
Yeah. Mm-hmm.
Mm-hmm. And do you prefer Botox or Dysport?
Dysport, I think.
Yes, Dysport's great.
Okay.
That's my favorite.
Yeah. Yes. Oh my gosh. So I'm going to go back to this because I'm so excited about that. It's just like that outer layer of skin. It's, if I could just peel it off, I feel like that's what I need. And that's what this does. Okay. I once was offered a CO2 treatment for free from a surgeon, and I was hesitant because his face looked unusually shiny. And so I thought, has he done too many CO2 treatments? I did it. I think it helped under my eyes, but truthfully, on a scale of 1 to 10, if you keep doing CO2 treatments, how high is the risk that you will have shiny face syndrome?
It's very high. People used to do it regularly. And what it does is it produces new collagen, but that new collagen shines light differently than your older collagen. And so that's one reason you look shiny. Another reason is that you're getting rid of a lot of the roughness of the skin and that you can appear shiny from that as well. So the recommendation is if you're going to do repeat CO2 treatments, which you can, just make sure they're spaced at least a year apart. Yeah. And it was also much more common in the past when CO2 was fully ablative. And that's where it was like every single little millimeter of the skin was burnt off. And that was a much different CO2. And that's what everyone has in their mind of like, oh my God, what's the downtime of CO2? I can't do that because I've seen so-and-so and they were all burnt up. That is how CO2 used to be, this fully ablative procedure where you're like weeping and whatever, like the skin's weeping for 2 weeks afterwards. And then it takes you months for the pink to clear. And, it is like a baby's butt. It's so soft and beautiful and looking nice, but it does take a long time to clear up that redness. And patients tend not to want that kind of downtime. So now a lot of the CO2 machines are fractional, and they're like fractionally ablative. So they have spacing in between the ablative channels. And you can set that amount of distance on anything. Like we can set it on our machine to whatever we want it to be. So we can make the, holes very, very close or a little further apart for somebody that is maybe prone to hyperpigmentation, such as, somebody who's got a lot of melanin in their skin. We talk about Fitzpatrick scale. So anything 4 and above, you want to be a little bit more careful. And so typically you don't want that, you want the distance to be, a little further apart.
Gotcha. So is it possible that some clinics might have an older CO2 machine? And if so, what questions should a patient ask to make sure they're not getting the older machine, if that's the issue?
Well, you could ask if it is fully ablative or it's fractionally ablative. That will tell you right there. I mean, whether it's an older or newer machine, that's probably the more important thing to ask of those two. And if you're going to go through it, you do want an ablative one. But fractionally ablative is just as good because, your downtime is going to be less, healing is going to be faster. And you don't need to burn every single, inch of the skin in order for you to have a great overall result.
Okay.
And so fractionally ablative. And then, you can ask other simple questions like, well, what's my downtime going to look like? Because if they could use a fractionally ablative one, but then crank it all on up. And so your downtime might still be 2 weeks if they're really being aggressive with you. So you want to ask those kind of questions like, well, how, is this going to be like a series of 3? Is it going to be a one and done? What do you think my downtime is going to look like? How quickly will I be able to, get back into whatever you're interested in doing, whether it's like, walks or exercise or work or anything, you can ask those kind of simple questions.
Okay. And so you wouldn't even want to do exercise where you're sweating after a CO2 treatment, or is that okay?
Anyone that has returned back to aggressive anything after that procedures like that have always had delayed healing. So I tell people, look, we just did this huge procedure on your face. Let your skin have some time to heal itself, especially when you're raw and chapped. You don't want to be going and adding your sweat and all that saltiness into those. Your face is going to burn. Plus, it's going to make you more puffy and more, it's just going to delay healing. So you don't even want to walk outside. I've had some patients say that they want to, oh, is it okay if I walk outside after sunlight? And I'm like, no, don't do that. But then they do it anyway. And then they're like, well, I'm just going to do it anyway because and then you're just like, fine, just do whatever you want. But then they've got this delayed healing. And for a month, I'm hearing from them, oh, I'm not getting better. And I'm this and I'm that. And I'm doing this and I'm putting this cream on it. And I went to an acupuncturist and I did. And I'm just like, what?
Oh, no,
what
no.
and they're making it sound like, wow, how come the healing isn't happening? How come I'm having this and this and that, and I'm having all these problems? And so it can be a lot, so I try to tell people, please give yourself some time to heal. You just went through this whole thing. Give your skin some time to repair itself under like a calm environment.
Yes. Like a broken arm, we all know and understand, put it in a cast, it's got to heal. But for some reason, when we do things to our face, it's like, I can still walk.
Yeah. Right. When can I exercise? When can I lift weights? And you're like, I'm injecting them with like, Botox or Dysport. And they're like, when can I work out? And it's like, well, what? Why are you rushing to work out? Like, do you understand the mechanism of action of this drug? Do you understand what it does? It has to go and attach to a receptor in order for it to function and work. And if you're going and you're sweating it all out before it has a chance, you can kiss that procedure goodbye and that money down the drain because you're going to have to be retreated. So, I tell people just at least wait 48 hours, but it doesn't reach its peak effect for 2 weeks. So, the more they take time off, the better.
Okay. And that's why we're doing interviews like this on, Beauty Seek. You might not hear all of what you're saying, potentially, based on, whoever your practitioner is. Okay. Smile lines. The up and down, the vertical ones, they seem to be more predominant on middle-aged women.
Drum ups. smoker lines up here.
Oh,
Yeah.
smoker lines. Yes. Okay. I thought smile lines would be kinder. But they seem to be more predominant on women than men, and it just doesn't even work to wear lipstick anymore for some women. What do you think? 1 to 10, how good is filler for addressing deep smoker lines?
Well, let's talk about what is happening and why people are getting those smoker lines in the first place. So it is from repeated pursing of the lips. So somebody who drinks a lot out of a straw, somebody who smokes, people that are pursing. Okay. So making that like, this motion is going to start cracking things. But it's also due to, as we age, we lose a lot of volume in our face. They say after the age of 30, you lose about a teaspoon of volume every single year. So when you're in your 60s and you've lost a lot of collagen and elastin because of menopause and other things like that, and you've been doing this motion and pursing and stuff like that, you're gonna end up reducing the volume even around the mouth. And what ends up happening there is just like a purse string, starts to cinch things down, and you see all these like lines around. The same thing happens with the mouth. So really, what is the reason why this certain patient has those? Is it because they're a smoker, and so no matter what you do, it's going to be hard to get rid of it because they're going to continue to smoke? They're 30 years old and they already have the lines. Or are they somebody who's like 60, has lost a lot of volume in that area, has all these lines due to volume loss? That patient is a little bit easier to help mute those lines out because you have to put volume back where you lost it. So oftentimes the pink of the lip starts to go down as we age. And if that happens, you need to restore the volume in the pink. Because if you just try to treat up here and you don't try to also restore the volume in the pink, you're going to end up with someone who looks really top heavy, and it's going to look bad. So what I like to do is I'll go in, and I don't like to inject directly into the lines like some people do, because then you see this weird texture of the upper lip as well. And that maybe doesn't crinkle, but the tissue that you didn't touch, that's the natural tissue, all of a sudden you see the folds in that, and then it just looks even weirder. So what I like to do is I like to make an entry site somewhere around here. And I like to depends on if the person has lost volume. I like to uniformly start to restore the volume across the area like this, and then across the lip as well. And that way I'm slowly making everything bigger, not so much that anybody can tell that they had that done, but just like microscopic, or a little amounts in there, just ever so slight, gentle, like strings of it, in such a fanned out way that it just restores the volume and looks good.
Amazing. Okay. And would you do anything like neurotoxin to stop the movement there? Because it's all about the repeated movement. Then is what it sounds
Right.
like.
So you can, that's called the lip flip. That's when we inject the toxin right, in 4 spots kind of on the upper lip. That can help. But I've seen a lot of people, you can tell when someone's had it done if they've, number one, injected too much and the person can't even move their upper lip, and they talk like this, and then they're talking and this, it's not like not moving at all. You know what I mean?
Yes.
And then also when they go to take a drink of water, or they go to, it's very difficult to keep the lips tight, tight, tight. And so some patients don't like it because then like the water dribbles down their down their face. But other women like it because it does help roll out the lip. It does create a little bit more volume in the pink. It's not really volume. It makes it look like it has more volume because it's relaxed and the muscle's able to kind of roll its way out. And it also helps with people that have sometimes a gummy smile. It can help with that as well. So there are a lot of patients that I have that do get that. They do like that. It's a very select few that I like to do it in, though.
I feel so sorry for people who carry acne or even chickenpox scars from youth into adulthood. And my thinking is you just can't get rid of a scar, really. 1 to 10, how possible is it to turn a facial scar into its former skin glory?
Well, it depends on what the nature of the scar is. If it's a cut, that's going to be a lot more difficult, because you can microneedle over that, try to blend it in with the regular skin. You can try to, it depends. Is it scar hypotrophic, hypertrophic? I mean, these are all terms of like, does it bubble out and it's raised, or is it like indented in like a stretch mark? Those are much more difficult to get rid of. It's almost impossible to get rid of those once the skin is stretched. Um, is it raised? If it's raised, you can try to microneedle to flatten it out and blend it with the surrounding skin. Um, it's all different kinds of techniques. Acne scars, CO2 laser can help a lot. A series of CO2, series of microneedling, or if there's a deeper like chickenpox scar that looks like like a, a deep, like they call it box scarring, then I've even gone so far as doing something that's called subcision. And that is where I stick a little needle in that the tip of the needle looks like it has a baby X-Acto knife, like one of those like artist knife.
Yeah.
And you go and you cut the band that's holding that chickenpox scar down. And once it's cut, then injecting a little filler underneath that to kind of plump it all out. And then usually over time, it heals in a much nicer way than the original chickenpox scar and can blend a lot more.
Ah, that's lovely.
Yeah.
So for chickenpox scars, there's treatments on a scale of 1 to 10 that might be at the higher end.
That's, usually anywhere, it depends on the person, but I've seen anywhere from 7 to 9, let's say.
Oh my goodness. And you were talking about your own scar story. Would you be interested in sharing that with our community?
Sure. So when I was pregnant and in Aspen for vacation, I decided to go to a spa and get a facial. And I remember the woman had asked me, "Hey, do you mind if I do extractions on you?" And at that point, I'm like melting into the chair. I'm like, "You do whatever you want. I don't care." And I must have had like a little bump somewhere on my forehead, right between my eyebrows. And so she tried to do something. I don't know if she even got anything out of it or what. But because I was pregnant and my body is trying to, produce another human, it's trying to produce. So all of a sudden, this one bump that I had turned into like a bunch of little bumps all right in between my eyes. It looked almost like grapes, but like stuck here. I mean, it was really weird looking. So I went to the dermatologist and they said, "Oh, I'm not sure, let me inject it with some local and steroid." So they did. And then they said, "Well, if it doesn't work because you're pregnant, I'm not going to inject it again. You have to wait until, all your hormones are gone. And let's inject it again and see if that works." So once I was done with my pregnancy, it was still there. It was very hard. And it was just an eyesore. So I went back to the dermatologist. They injected it again and it did not go away. So then the dermatologist was like, "Oh, well, I got to biopsy it because, they all want to do that." And he took a big scoop out of my forehead right here. And at that point, I was like, "What did you do?" And it was like fuchsia. And we had moved back. At that point, I was in Miami, but moved Michigan. The guy did that. And then went back to Miami. And now I'm in Miami. It's so hot. I can't keep makeup on it because it just sweats off my face in 2 seconds. And it was like fuchsia. And it was terrible, right between my eyes. I don't know if you can see.
Oh, no.
Can you see any kind of scarring? Anyway,
No.
I went through hell and back to try to get rid of it. I did CO2 laser, fat transfer underneath it, filler, all kinds of stuff to try to get rid of it. And the only thing that got rid of it was injecting Botox directly into the scar. It like took care of it. It was weird, but
What is the science behind that? Why would that work? I wouldn't have even thought.
remember it was fuchsia. And that's because from the scar, there was new blood vessel growth. And so that's why it was so red. And, you push on it and it would blanch and then it would go away. Well, there are tiny, tiny muscles. Your blood vessels contract and they relax, and there's muscles within it. And Botox is a muscular paralytic. And so injecting it directly into it somehow was able to close those little tiny blood vessels up and, kind of reverse anything that I was dealing with. And so, so I had to do it over, a series of times. It wasn't like a one and done, but over time it ended up, clearing up and taking care of it. So yeah.
That's amazing.
Yeah.
That kind of is so great that there's hope. I love the story about, kind of being able to cut underneath the pock marks, but that's amazing. I don't think I've ever heard.
I did not have subcision. I did not have subcision to that area, but
gotcha.
Luckily with everything else and the fat transfer and this and that, it just ended up kind of helping.
Well, you have a beautiful forehead.
Thanks.
Beauty seekers, thank you for being part of our growing community. Please help us continue to grow with a little click of the subscribe button. Every subscriber makes it possible to bring you conversations like this one, where Dr. Sarah Yovino is teaching us about her 3 T's of facial health: tone, texture, and tightness. Thank you so much for being with us today. This has been an amazing education. Beauty seekers, thank you, not just for watching, for being part of a community that believes you deserve proper education so you can make the best aesthetic decisions for you. Every new subscriber is a point of proof to us to stay focused on our mission, to bring beauty seekers like me and you aesthetic education from doctors like Sarah Yovino. The more educated we are, the better aesthetic results we like to get. All right.
That's true. And thank you for having me on your show.
Absolutely. It's been a pleasure.
You're welcome.
You just learned that a scar can be treated and reversed to its former glorious skin. And if you think that was amazing, Dr. Yovino is about to change your mind about facial volume loss. The solution isn't necessarily injecting your face with fillers. After that, she's going to share the best treatment plan that will bring you closer to that soft, smooth, creamy baby skin right here on Beauty Seek.